Leslie, if I'm a new patient and I'm either coming into hospital for my first appointment, so I'm coming into hospital for my first ever operation, is the COVID SURG leaflet still useful for me at that stage?
Yes, it does. It talks you through the process of what you could expect in general terms if you're considering surgery. It talks about the steps in the process as well. And also it talks to you about how it has changed in COVID times and that you can expect to have some virtual meetings as well as face-to-face. It also talks to you about the questions you can ask about what to expect on entering a hospital. It talks to you about how the nursing staff and the health professionals and the consultants could look different because they will be wearing full PPE. It explains to you what that actually means in reality. And it does talk about the risks of coming into hospital and how the hospitals are working to mitigate against those risks. We have 3 booklets. One goes into a lot of detail to help really set the full range of questions and areas that you may have possible concerns about. There's another one that is like a basic user guide, which allows you to read that and think about what questions you would like to have with further telephone or video consultations and what you want to think about before you go in and when you're in. And the booklet also talks about what you can expect on exiting the hospital after surgery, who you could meet, self-isolation, if you tested positive, etc. So it's really very much there to act as, I was going to say a second pair of eyes, to help support you in thinking about questions that you would like to ask, because you may know a lot of the questions, but you may not know all of the questions. And that booklet there is really there to give you support, to give you the reassurance that you can come into hospital to have safe surgery.